Good evening, and welcome to another Sunday evening with Brian and Janice. We're just delighted to be with you today, and we hope everyone has had a wonderful week and a great weekend. We're going to start out this session today discussing vaccinations or vaccines. Everybody seems to be in such a dilemma concerning the vaccine for COVID. I don't proclaim to be an expert on the vaccine because I think it's fairly new to everybody. It's only been in existence for right about, not the vaccine, but COVID has been in existence for right about 9 months with us, known to us. The vaccine, however, they've been working on this vaccine for over 6-7 months. And I'm not mistaken, is what Dr. Fauci said. So with that being said, I just want everybody to tune in and listen. With my knowledge base and having been dealing diligently with a lot of COVID patients, I know the urgency of this disease. I know a lot about it being on the front lines that a lot of people don't really get exposed to. So without going any further, I'm gonna let Brian open us up and just letting you know that will be our core topic tonight. We'll be talking about the COVID vaccine and what you need to know about this vaccine.
So good evening, Facebook family. Good evening, YouTube family. We're going to allow this session to be handled by the expert witness on the case, Miss Janice May. She is going to be kind of breaking down for us and helping us to understand the whole concept of the vaccine that's coming out. Now we do understand that it is in process of being shipped throughout the United States. We know that they are urging medical professionals to be the first to receive
the frontline workers, healthcare workers,
to be the first to receive the vaccine. And we do understand that from there, the elderly are going to be receiving the vaccine, those that are high risk, I guess you would say.
Yes.
And then from there, it will be proportioned out to
the general public.
The general public,
yes.
Right. So my question is, and I guess I'm the one that is playing devil's advocate on this situation. So I have a lot of questions, especially surrounding the history of medical mistreatment in the Black community, and specifically dealing with certain experimentations. Okay, so we have a broad and long history as it relates to that, and a lot of the history is not even yet revealed.
Yes.
But the history that we do know as it relates to Black people receiving medical treatment by the hands of our oppressors hasn't been one that's nice. So my question to Janice is, and as always, is what is a vaccine? If you could explain that to us. How does a vaccine work? What are if any, I understand the benefits, but what are the possible, would be the possible failures, I guess you would say, of the vaccine, or the bad part, the side effects, if any? I know you don't know that, but what could possibly be some of the things that could go wrong as it relates to the vaccine? So if you would explain to us, what is a vaccine and how does it work?
Well, most of you that are familiar with vaccine or have had children know that from the beginning, at about 6 weeks of age of infancy, the infant goes to the doctor to get vaccinated. We've all been vaccinated at some point or another. So you know that there are several different types of vaccines. We have the live vaccine. We have the...
And what is the live vaccine?
That's actually giving you a live virus.
Okay.
Okay?
All right. So
that's clone that virus, and we're giving you a small portion of that actual virus. Okay?
Okay.
And then there's the inactive virus, which is basically, it is a virus, but it's not active. It's basically dormant, but it does serve its purpose in you getting that vaccine. It makes, if you get that particular disease, your body will recognize it, you know, all right? And then there's called the subunit and the toxoid, which are a little more in detail, and we don't deal with those a whole lot. But then a lot of people want to know, can you get multiple vaccines? Yes, you can. Anybody that has ever been in the military or familiar with the military, know you can get many vaccines within a certain length of period, within a day.
So that's considered a what? Conjugate vaccine?
That basically would be conjugate.
Okay.
Also, when people get the flu vaccine and pneumonia vaccine, you're getting both. And both of those are live vaccines. Both of those are live. And
so they would be considered a subunit because they're two.
This two.
Okay.
Okay.
All right.
All right.
So we understand.
We got that. And what we're looking at with COVID, and this is where a lot of people are very unsure about. As you know, people that have had COVID and they have bounced back from it, or had COVID and have no reaction from it, no symptoms. Let me put it like that, because my daughter had it and she had mild symptoms, but it didn't completely put her down. I guess I've come in contact with over 200 plus patients that have had COVID since this virus has been on the scene, and I've seen a vast array of symptoms. But one thing I do want to encourage you, that just because you've had COVID, it does not mean you can't get it again.
So who are the ones that are most likely to relapse and contract COVID again? What type, as far as medical group of people, do you see relapsing and contracting the virus again?
Well, what we have seen a lot in Montgomery, I can speak personally, is that we have seen people that contracted the virus, had mild symptoms, came back in contact with the virus again, from what we can tell, and the symptoms were worsened this time. This time they actually they became symptomatic. Asymptomatic
so
means no symptoms. Symptomatics mean you have symptoms. Now, to the extent that you have symptoms, I tell people it is totally based on your immune system.
Okay.
And that is why we are encouraging people to please keep your body healthy. You know, take your vitamins, get your rest, you know, limit your alcohol intake, limit your amount of carbs and sugars. All of those things serve as precursors to the extent to how this vaccine is going to affect, this virus is going to affect you. What we see in our practice is not just the elderly, we see people with pre-existing conditions that are really affected by this disease. And when I say pre-existing conditions, I'm talking especially those with diabetes, those with any form of heart disease, hypertension, or having had cancer, recovering from it, lupus, just a vast array of diseases, or just a low immune system. You have people that have asthma. You know, they may have not had a exacerbation with asthma in months, but come in contact with someone with COVID, and this flares their asthma up. They may think they're just having what?
An asthma attack.
An asthma attack. When in actuality, they may actually have COVID.
Symptoms of COVID.
Symptoms of COVID.
So would you say now, if with people with high comorbidities, such as diabetes, hypertension, asthma, some of these sicknesses and illnesses that you named, do you think, because the vaccine is just a small dosage of the actual disease itself, could they have an allergic reaction to the vaccine and cause them to develop full-blown symptoms that they may not recover from? Is that a possibility with this vaccine coming out? Or with your medical knowledge, have you seen some, say for instance, if you get a flu vaccine, it gives you symptoms of the flu.
Yes.
So your body will be able to build up antibodies to
Yes.
fight that off, correct?
Yes.
So could this vaccine possibly cause someone to have a severe case of COVID that may cause them to go into
Full-blown
COVID and they not recover?
You know, I want to support the experts on this. And as Brian can tell you, I have been avid about getting all the information possible about this disease. I research and read about it every day, and I see people every day that are recovering and have suffered from COVID. But what I can say, if you just think logically, anytime you're given something live, there is a chance that you may have a reaction to it. Yes, it is possible that those that get the vaccine may develop severe symptoms. And what I encourage everybody to do at this time, and I just found out this recently from Dr. Sanjay Gupta. They're saying that those people that range from the age of 18 to 55 are more likely to have symptoms from the vaccine, maybe lasting 24 to 48 hours max.
But that's not been proven yet because no one has taken it, right?
Not in the U.S.
Right.
Not in the U.S. Now, the symptoms that they are seeing from the vaccine are those that have severe allergies. You know, there are people that are allergic to peanuts, eggs, fish, chicken. And even when we give the flu vaccine or the pneumonia vaccine, we ask you full detail. Are you allergic to fish? Are you allergic to eggs? Are you allergic to chicken? You know, chickens. You know, what type of low immune system do you have? We ask those questions for you to gauge, is it safe for me to take even the flu vaccine?
So could this vaccine alter as far as our gene structure? Could it actually do harm later on or produce side effects later on, say a year from now? Is there a possibility that side effects from the vaccine could actually happen and be more injurious to the individual than the actual disease of COVID itself? Is that a possibility with the vaccine?
It is, and it is in this way. And let me put it this way. I'm not talking about the vaccine. I'm going to speak on the disease. We have people that have encountered the COVID that have never had one issue as far as medically. No diabetes, no heart disease. And they develop COVID. Within 14 days, they're down, feeling achy, like flu symptoms. They say it's a lot worse than flu symptoms because you hurt everywhere. You have some that have a lot of GI discomforts. You have the diarrhea, you have the nausea, you have the vomiting, you have the loss of smell, you have the loss of taste. You just hurt all over. And this is coming from younger people that I've encountered. Now, these same people that we're seeing 6 months down the road are having breathing difficulties, meaning something that they never had problems with before. Now they're having trouble breathing. And initially, of course, we couldn't put two and two together. And now we're seeing, after we go back and you x-ray and you do CTs of the chest, of the lungs, you see that these people actually have granulomatous spots in their lungs from the virus, which is a viral pneumonia in the lungs.
Yeah. So I'm going to get back to the vaccine. We've heard 1,000 stories. We understand the COVID. And I know you want to break this down medically, and we appreciate your knowledge, dear. But the vaccine is on its way.
Yes, it is.
Okay. You, as a medical professional, and I know you cannot give advice on whether or not to for someone to take it or not take it. I understand that. I understand the position that you are in. Myself, as a historian, I have to go back to, my mind automatically takes me back.
To Tuskegee.
No, to 1721
Wow.
and 1722. Takes me back to a slave named Onesimus, who was the slave of Cotton Mather. Cotton Mather was a Puritan preacher. He is the one that actually chronicles in a lot of his writings how to treat a slave. He's also the one that follows through with the whole ideology that slaves are inferior to European people. Okay, but now his slave Onesimus is one of the first to bring the actual, what we know as vaccination today, to the United States. In 1721, 1722, there was an outbreak of smallpox. And Cotton Mather, when the outbreak happened, Onesimus goes to Cotton Mather, to his slave owner, and says that we encountered this in my homeland of Africa. And this is how we treated it. We would take pulse from the smallpox and scrape it into the skin of those that had not yet developed it. Okay,
that's
so
vaccine.
That's where the whole concept comes from.
Mm-hmm.
So we understand that vaccinations have been around for a long time. It was first introduced in the colonial states by a slave named Onesimus. Okay, brilliant. And he said that their people had been doing this for centuries. Europeans had never heard of it. Okay, so now let's fast forward, and then we can go to James Marion Sims, the gynecologist that does the experiments in the early 19th century on Black women without anesthesia, without any type of form of treating them for pain, and does gynecological procedures at the, just the all, so to speak, of these women without pretty much their permission in reference to repairing their cervical area, things of that nature. So and then you can move up to the Tuskegee 1932 syphilis experiment, where 600 Black men, 299 that did not have syphilis, that was actually inoculated with syphilis, okay, and then the other 301 supposedly already had syphilis and was yet experimented on, and so, and then you got to get to Henrietta Lacks, okay, 1951, where they take her cells. She has cervical cancer. They take her cells and they use her cells, and that's chronicled in the book, The Immortal Life of Henrietta Lacks, okay, written by Schools. And also another good book is Medical Apartheid, written by Harriet Washington. So that chronicles all of the mistreatments of African American people by way of the medical profession. Now, I understand. I mean, you're a medical professional, so we have to trust to some extent the ethics, and have to trust that the oath that these people take, yes, that they would live by and honor that. We have to trust the WHO. We have to trust the CDC. We have to trust the FDA. I understand that. And hopefully they will do what's best as it relates to the interests of all people and all humanity.
Yes.
And hopefully that this will not be something that's put into the Black community that further damages our community or further hurts our people. So I question it from a historical aspect, just as it relates to the many maltreatments that we have suffered by way of medical experiments. But I do understand the necessity and the need as well for the vaccine. I understand that there are going to be some deaths involved. That can't be ruled out, because anytime you have trial basis, or you're dealing with a vaccine that's been really untested,
Yes.
It's going to affect people differently based on certain medical issues, based on their immune system, their blood type. I'm sure all of that stuff factors in.
It does.
So I do understand that there are going to be some deaths involved. And like I said, I'm not putting you on the spot, and I don't want you to. I know you can't recommend that. Who gets it, or if we should take it or shouldn't take it. But are there advantages to taking it? Like I said, what are the pros and the cons?
Well, Brian,
if you've never had COVID, okay? So let's just say, for instance, I've never had COVID, okay? Let's say, and I took the vaccine. Could it possibly cause me to go into my body to go into a state of shock, and I end up in the hospital on a ventilator? Could that possibly happen if you've never had COVID?
You can have a reaction to any vaccine.
Okay.
You can. My biggest question that I've asked several of the pulmonologists here in Montgomery, and the cardiologists and the endocrinologists, is that we know that COVID thickens the blood. You see it everywhere. You see those cells. They show you pictures and diagrams of those cells. They have like little feet or something on each one of those cells. So when they travel through the bloodstream, they are thicker. So when I say that, I'm saying that a healthy individual basically can handle it and bounce back from it, typically.
Okay.
But if you have someone with pre-existing conditions that are already, they are very susceptible. That is why we encourage people that have high blood pressure, hypertension, diabetes to take a little aspirin a day, a Bayer aspirin, 81 milligrams, not necessarily Bayer, but whatever. Just take a baby aspirin, 81 milligram aspirin a day. That is just preventive. It's not to prevent. It is preventive. That's just in case you can develop a clot from anything. And that is one of the things that COVID has known to do.
That's one of the symptoms.
That's one of the biggest things that they're seeing, side effects of COVID, is young people developing clots. Because that virus, it is aggressive, and those cells are bigger than the normal red blood cells. And they're traveling, trying to get through the veins and the arteries, and they're bigger. So they can compile together and formulate a clot. And when that clot dislodges, it can go to the brain, to the heart, to the lungs, whatever. That's why so many people that get COVID end up with blood clots. So we do know that. And this is a subject that I don't really like to talk about, because I've lost many friends to COVID. People that I've had a very close relationship. Brian and I just lost a very, very close and dear friend of ours to COVID. But he was a diabetic. But in saying that, if a diabetic is normally taking their medicines as recommended, if they're keeping that A1C, that means that A1C within that range from 6 to 7, you pretty much, I believe, can battle through this. That means you're not out of order. Your body is.
So what would you recommend as a natural remedy, as a preventive to fighting off the virus?
Okay.
What would you? Because everybody's waiting on the vaccines. Basically, when you go in the hospital, there are certain treatments that you receive if you are a COVID patient. So once a person recovers from COVID, we understand that there are symptoms that are following them, pretty much are going to be with them.
Yes.
Like you were saying.
Probably the rest of their lives.
Right. The breathing, they may have difficult breathing. So they may have a number of issues
Yes.
related to
COVID.
having recovered from COVID. So what would you or can you recommend any type of holistic treatments that would benefit them from recontracting the virus and possibly reverse some of those symptoms that they're dealing with post-COVID?
Okay.
So what do you,
Let me
outside of the
Western side.
right?
Okay. Western medicine, as we know, I am just Brian said I'm too westernized with medicine. But what I do know is that when people call and say, I've contracted COVID, okay? We're going to say, okay, this is what you need to do. Quarantine yourself. They've cut it down to 10 days. I still stick with the 14 days. We believe in the 14 days. Our doctors have not deviated from the 14 days. We also order them a steroid dose pack, which we don't give to diabetics because diabetics typically cannot tolerate steroids because it will cause the blood sugar to go higher.
So what do we?
You want natural? I'm going to give you the two sides. Let me give you the Western medicine
all right,
side.
we got you.
Okay, we typically say, and we always add an inhaler to it. We add an inhaler, and then we get your one a day inhaler, and then we give you a rescue inhaler. We also encourage them. We put you on the Z-Pack. Everybody knows about the Z-Pack. That's the antibiotic that you take for five days. You take 2 the first day and then 1 the next 4 days. So that has proven in the early stages, when you first get diagnosed, if you're having minimal symptoms, that remedy right there has proven to work. It has kept people from going into the hospital. Now, what can keep us from contracting COVID? People ask me every day, Janice, you're around this all the time, every day, 8 to 10 hours a day. How have you not contracted COVID? Number one, I wear my mask. I double mask. And I wear a shield. So we are very protected. Wash your hands. So many times we don't even think about washing our hands. I just washed my hands 5 minutes ago. I keep sanitizer wipes in my lab coat that I use throughout the day. When I come out of one room into another room, I'm using them to wipe my hands. Everybody should do that, whether you're in the hospital or in a healthcare facility or not. Wash your hands. Try your best not to put your hands near your eyes, your mouth, or nose, period. Unless you have just washed your hand and you have not come in contact with anyone. All right? Now, Brian, we will get to the
let's do
holistic part.
Okay.
The wellness state.
What can we take?
Zinc, for one.
All right. So what does zinc do?
Zinc is an immune booster, along with vitamin C. Everybody knows that vitamin C is a great immune booster, and it is. And we should do that anyway.
So what are some forms of vitamin C? What is the purest form of vitamin C that an individual can take? Apart from vitamin C tablets or something out of the drugstore or something out of Walmart, what is the natural purest form of vitamin C that we can get from a food?
An orange.
Okay. So orange is one form.
An orange is one form. Is a great form of vitamin C. I think because I'm such an advocate, I like oranges. Any citrus fruit, citrus fruit is a great
grapefruit.
Mango is a good source of vitamin C. So those are things we tell our patients. Vitamin C, load up on vitamin C. You can't get too much of anything, but just do a normal amount of vitamin C, and that's every day.
And something else we could recommend, and I'm not a holistic professional, though I've studied it and really believe in the holistic natural healing.
Yeah.
Something that is very good is silver.
Silver, yes.
Okay. 150 milligrams, 200 milligrams. Actually, when the Ebola outbreak happened in Africa, that was one of the holistic natural drugs, remedies, right, that they began to give those people that contracted Ebola. It was so effective that the WHO halted it because it was putting the pharmaceutical companies, really hindering them, because the African healers and holistic doctors were using silver. And the WHO stopped them because the results were almost 99.9% recovery. That is one thing that you can also use. Turmeric.
Turmeric is great.
Is another great immune booster.
Yes.
Not only that, it helps with inflammation. Mm-hmm. It opens bronchial tubes. Okay, so there are a lot of things. Natural ginger, the ginger root, is another great immune booster. So these are some things when we're talking about, because we don't know what this vaccine is going to bring.
We don't.
Only thing we can do is hope and pray that the creator of the universe and the creator of all people would be in control of this. Yes. But we are going into this blind. We're going into this trusting that these healthcare professionals that run the WHO, the World Health Organization, that runs the CDC, Center for Disease Control, runs the FDA, Federal Department of Drug Administration. Mm-hmm. We're trusting that they've done everything to make sure that this vaccine would not adversely affect our community worse than any other group. And we're praying that if this thing is something that is been genetically, put in place, engineered, right, and to adversely affect our community or adversely affect those that have these, certain diseases, that this would be turned back. Now, I support the overall health of an individual. So historically, like I said, when I look at it, if you all get a chance, there's a good book out called Medical Apartheid. I've mentioned this earlier.
Yes, Medical Apartheid.
By Harriet Washington. Get that book. She chronicles from the early 1700s, all the way up till now, the 21st century. As early as 2007, that we were still dealing with. When you talk about the Tuskegee experiment with syphilis, that lasted 40 years, from 1932 to 1972. They were still experimenting on these men and still experimenting on poor people. I don't even have to get into the history of eugenics and Charles Darwin's theory, where the strong survive, and the whole concept that is born out of his theory. When you look at Goddard, his cousin that introduces eugenics to America, is based on the African being inferior, a substandard human, and being one who should not procreate to keep his lineage in place. So there's a long line, like I said, family, that we could go through that really is questionable to me. But I cannot, just like Janice can't, we can't tell anyone not to take the virus. And I can't advocate for anyone to take it. What I advocate is you have to use your best judgment and know that we have to trust these professionals that do this, the scientists that do this is part of who they are on a daily basis. So we have to trust that. We have to trust now this government that have been against Black people since the inception of this country, to now hopefully do the right thing, because it's more than just black people that are affected. So, and we have to trust God above all things as it relates to this. So,
well, we do know, Brian. Yeah, if a vaccine is available today, right now, would I take it right now? I don't know. I don't know. What I do know is that there are employers out there that are going to present their employees options of taking this vaccine. And there was
there's a mandate being put in place as it relates to travel rights.
Right.
So if you do not, what they are stating is basically you will have a vaccination card, COVID vaccination card, that allows you
to go
to travel from one state to another state, or one country to another country. If you do not have that vaccination, that COVID vaccination card, then you will not be able to travel outside of the United States, and possibly, depending on what the states impose, you may not be able to travel to certain states within the United States. So this is I think, a complex thing. My mind goes back to the restrictions of slaves traveling from one plantation to the other. When those prohibitions were put in place, where we could not travel. It takes me back to colonial subjugation and colonial oppression. And specifically, the vaccine is being made available to everyone. So there's no charge. Is that correct?
That is correct.
Okay,
there is no charge.
There's no charge for the vaccine. So hopefully, like I said, we have to trust God. I understand there are a lot of unanswered questions that everyone has, including myself. And that's why we wanted to have this discussion. So people can understand what a vaccine is, what it does, what it doesn't do, understand the risks that are involved in, taking a vaccine. And we're not encouraging, like you said, anyone to take or not take. That's something that we can't do. And I'm not, a doctor. But I will say this. I really encourage
people with comorbidities to get it.
Okay.
I really would, because they cannot risk coming in contact with someone with full-blown COVID in their homes. You have the elderly that have grandchildren, and they want to see their grandchildren, and they may have some side effects from this vaccine, but it will be much safer, I truly believe, for them to get this vaccine.
So that's basically your professional opinion.
That's my professional opinion. It's not that I'm recommending or I'm advising, but the research that has been done thus far does encourage those people with pre-existing conditions like that, especially your elderly.
We still haven't seen any data on the effect that it has had on those people that have
taken it in Britain.
That's right. Those previous illnesses.
No, we have not.
So,
and that is concerning.
The only thing that they are talking about, if you look at the news feeds, they're talking about the two healthcare workers that were had high allergy risk.
Yes, they had allergies, high allergies, multiple allergies.
Right. So we don't know.
No, we don't.
Because there's no data that tells us what the reaction
would be.
Is.
I can say, out of my 30 plus years, I've given many, I'm sure thousands and thousands of vaccines. I've never had anyone, to my knowing, die from getting the flu vaccine or the pneumonia vaccine. What we do know is that some people, including myself, When I take the flu vaccine, I have to make sure that my immune system is top A1 condition, because I tend to get the symptoms pretty bad, and it puts me down about a day. Mm-hmm. But I would take that risk if it meant saving me from getting COVID or dying from COVID. Mm-hmm. So there's a lot out there, and this is so new, and I tell people every day, no one really knows. Mm-hmm. Dr. Fauci
is Dr. Fauci.
That's
you don't need to say any more on that.
He is an infectious disease specialist. He studies diseases, viral infections, bacterial infections from sunup to sundown. This man, he knows. But COVID has thrown them all for a loop. They don't want to panic. They don't want to set off the alarm because they don't want you to be alarmed. But what you can do, you can keep your body healthy.
That's what we encourage, is the natural, holistic, preventative by way of nature.
Brian, tell me. Brian went to the health food store yesterday, mm-hmm. and just browsed and researched and read, okay, what is this going to do for me? How will this help me? Will this boost my immune system? Will this keep my blood at a level where I'm not so susceptible to blood clots? I tell people, blood clots are dangerous. They are nothing to play with. And what I say, if you have had COVID and you recovered from COVID, when you go back to your doctor, do two things for me. Number one, ask him, can you be on an inhaler? That to me is a life changer, because when you can't exchange air properly throughout the body, guess what's slowing down? Your blood flow.
Mm-hmm. But how do we, see, getting on inhalers, just putting them on another medicine, how do you holistically reverse that? I mean, I can't tell them to
Turmeric.
Yeah, that's right. And I'm not the healthcare professional, but I don't believe that Western medicine has all the answers. I believe that Western medicine, it is what it is. It has its pros and cons. I'm not in the medical profession, so I don't try to act like I know everything on that. But I do encourage healthy eating. I encourage doing research, finding out about nature proper healers. And there are so many different healing
properties.
Yes. That exists within nature. Rhubarb root
elderberry.
is fantastic.
Yes.
So all of these things, elderberry, dandelions, mm-hmm. Iris sea moss, all of those things are nature's way of getting your body chemically balanced so that it not only gets rid of disease, but it reverses disease.
And one thing, it keeps the body more at an alkaline state. Mm-hmm. And I tell everybody, and if you've ever had any form of biology or chemistry, diseases cannot survive in an alkaline environment. They need an acidic environment to thrive in. So when we're drinking sodas all the time and juices and chips and candy bars and this, you're putting your body with all that sugar and the carbs, you're making your body so acidic that anything can come by you and you can catch it. Mm-hmm. That's just true.
There are more people that die of, and don't know it, of sugar, an over intake of sugar, which causes diabetes, heart attacks,
obesity.
Mm-hmm. There are more people that die from the actual ingestion of sugar because they've eaten so much that it have caused their body to go into a dormant state chemically, and it doesn't produce the natural antibodies anymore. that would fight off some of these diseases. And
Exactly
now
right.
they're dying from this.
That's exactly
so
right.
we
Yes.
we need to do the research, we need to do the study. And a simple way of putting it, when you talk about alkalinity, I think of it this way. If you keep a swimming pool alkaline, no algae can grow in it.
No algae.
At all. Nothing can
cannot.
live in it. You can get frogs, snakes, whatever can
They're
live,
gonna die.
and they're going to die.
Yes.
So the same thing happens within the body.
Yes.
So there are certain food groups, green vegetables,
Yes.
spinach,
Kale.
turnips,
Collard.
Kale has to be cooked.
Yes.
Okay, because kale actually possesses a small dosage of poison if you eat it raw. So kale needs to be steamed or cooked at least to get some of those poisonous enzymes out, toxins out. That's exactly right. So these are things that we can do to prevent our bodies from having adverse reactions to not only the COVID virus, but they're going to be, now the scientists are saying that this is just the start of many viruses to come that are going to be worse than COVID. So they're already gearing up for the next pandemic.
Well, they knew this one was coming. They didn't know the name of it, but
they knew that was going to be a pandemic.
Yes.
But whenever you have something, and I don't know, I mean, I've done so much reading on this. It's interesting. So we have to understand that food is our best medicine.
I love that.
Yes.
Thank you.
Food is our best medicine.
Food is your best medicine.
Yes, absolutely. So let's put the right thing in our mouth.
Yes.
You are what you eat.
You are.
Believe it or not, you really, really are. If you eat unhealthy, you're going to be unhealthy. It's real simple. This is not something that it takes a rocket science to figure out, right?
No, it doesn't.
So we have to start going back to the table and looking at what we eat.
You know, and all this fast food, Brian, we talk about this all the time.
Yes.
We don't, if you're eating out, eat healthy out. Mm-hmm. We were just saying that today. Yes. Eat as healthy as you possibly can out.
Yes.
Because you don't know who's preparing that food and how they're preparing it. We hope that it is meeting the
standards,
FDA
right?
standards, and they got a great score. I always look at the scores. So, use your...
Yeah, you have to use your better judgment. And that's with anything. We want to be safe. And that's what we're encouraging, that you be safe. We're encouraging, like I said, preventative medicine is the best medicine.
Yes.
If you can prevent your body from going into a state of shock and whatever it is that it does based off of not putting the right things in it, then we encourage that.
That's
do the preventative.
Yes.
Don't get to the place to where you have to trust or put your life in the hands of someone that is just as unsure about a medicine as you are and cannot really give you the answers that you're looking for.
We're practicing every day.
Absolutely. That's why it's called a practice, right?
It's called a practice because we're practicing medicine every day. Mm-hmm. We don't know, but I can assure you of this. The pharmaceuticals are getting filthy, filthy rich because they actually court doctors' offices every day, bringing in medicines after medicine after medicine. So just be mindful. There's been a lot of recalls on medicine, especially heart medicines, blood pressure medicine, and diabetic medicine. There was just a massive recall on metformin, and that's known to public. So the best medicine is the food that you eat. Mm-hmm. And I'm a testimony to sugar. I was addicted to sugar. My coffee was not coffee. I put coffee in my sugar. I could not drink coffee without loads of sugar. Am I right, Brian? Sugar and cream. And I love my Starbucks coffee. Oh my God. So I can tell you, I had major withdrawals when I came off of it. I thought I wasn't going to make it. I said, I can't do this. And that's just a mind thing. You can do anything if your life depends on it. So I will say this, if you can cut out the sugars, get them down to a bare minimum, and the carbs, and get your vegetables, fruits and vegetables in there. And we have to tell diabetics, be careful with the fruits, some of the fruits, because
have a high content of sugar.
Because they have a high content of sugar as well. One of the things we tell diabetics, don't harbor on bananas. Bananas have a lot of sugar in them. I love bananas. You just can't overeat. You just can't overeat. One a day is fine, or one every other day.
Because they're natural sugars.
They're natural sugars.
That's right. So there's a big difference between the factory sugars.
Yeah, fructose and sucrose and all of those.
That's being produced in the factories as it relates to natural sugars that come out of your fruits and your vegetables. So even vegetables have some amounts of sugar. Yes. So with that, we're going to end. We wanted to just kind of veer away from the normal course, and we wanted to deal with this because it's all over the news. The vaccine is on the way. They have shown it being shipped out via FedEx planes and via the ground trucks. So it is on the way. So we encourage everyone, be studious, be diligent, be safe as it relates to this vaccine. And hopefully this information will help you to be aware if you decide to take it, those that need to take it. Hopefully this will make you more informed and will cause you to even do some research. And when you go sit down with the doctor, ask questions.
Ask questions, please.
I'm an avid question asker. They want to kick me out the doctor's office because I be telling them this is what you need to do for me because I know my body better than you do. And that is a good thing. So I encourage everyone, know your body better than the doctor. Yes. So that means you do take some time to know thyself. Take some time to study your own body. So when you go to the doctor, you could recommend to them, this is what works for me. We go to the doctor wanting him to recommend to us when a lot of times we know what to do and we know what we should be doing. And we're too lazy to do those things. So my thing is, let's not be lazy. We want you to live and not die. So let's do what you need to do to get yourself healthy. So with that, family, we're going to sign off. We're going to say peace and love to you. And we will see you on next week.
Yes, same time. Sunday, 6:30.
Bye-bye.
Love you guys. Bye-bye.